So next presentation is my presentation. I am Dr. Rahul. I am a scholar of ICMR, New Delhi. I am a scholar of the Hindu University of Florida. My topic is clinical feature of children with autism spectrum disorder. So I would like to brief about this study is important, and it is a pre-treatment study because not in India, across the world, it has been seen that especially for the developed and economically background country, especially from the black racism, the diagnosis is not perfect. So the treatment went wrong. So that is one of the important. So what I would like to, if the treatment is diagnosis is correct, the treatment is easy. So the clinical feature of autism spectrum disorder from the African and the low side of the countries has addressed the gap of their clinical characteristics. So what I did, 120 samples from the low side of the country has been involved in this study and find out some character the students child they have the autism character. So the WHO and the USA Medical Institute has developed the DSM-IV criteria for the standard diagnosis of the autism. So some parameters to find out the children suffered from the autism. This is the very close monitoring, and the person who only able to find out those are the kindness and towards the child. So in that study, we examine the socio-demographic character, including the children, sex, age, their parents, age of the parent, and education level is important. Directly go for their treatment and the higher study. It is requirement their background. We studied clinical feature, including their diagnosis, how they alert, how they wake up. The presence of severity has been studied. So among the 120 samples of the child, out of that, 87 were boys and 33 were girls. That is important. These two ratios are the mismatch because the population more is the boys rather than girls. There's a reason. According to the children parent, 54 parents reported they are disordered in alert signs. They're not alert. They are not cognitive intellectual. And 62 parents, they shows the symptoms they alert. That is one of the important why they are not intelligent. So they are not able to the alertness. So some of the parents, they check their behavior. That is one of the known as a behavioral study. How they move their hands, their legs, their lips. So the interaction disorder, parents, they found some epilepsy characters, some cerebral palsy, and hearing impairment. Hearing impairment, so they not heard properly, so they not pronounce properly, and they not intellect how to proceed. The main clinical feature of 120 children follows this type of the character autism, that is a delay in diagnosis, speech co-occurring with the epilepsy, hearing impairment. And these are the severity shown in the ASD, that is the autism spectrum disorder. So autism spectrum disorder, it is a character of the social interaction impairment. They are not socially. They may reserve, that is a character. It is a good character. They are reserved. That is a good character, but they are unable to the socially. They may ask for the help. Even though need the help, they're not able to express their help. So they are the socially impairment. Restricted repetitive behavior in the child. Repetitive behavior, repetitive speaking, repetitive action. This student, this child, they are not diagnosed, they are not seen in a one shot. They are unable to check the status in front of in a one shot. They are not that type of capacity they have. So in a worldwide, 0.6 to 1.5% in developed countries. What the status about the low side of the country? The developed countries, they have the 1.5% of the children suffering from the autism. How much it is important for the study? The prevalence is largely in a low-income country. If the suffered the developed country, I am strictly speaking about the Europe and the United States. So it is very difficult to about the African countries. So the ASD, that is the autism spectrum prevalence, the 0.07 to 33% children suffered. 33%. It is a major number. The result may reflect the variability of the clinical methodological approach. Healthcare practitioners is important. Healthcare practitioners approach is there, should be the change. But intervention and the extension about the science, particularly for the children, is important. So the clinical picture around the world is important. Specialist diagnosis, autism, subsequent influence management condition is globally is important. The reason is that because the directly approaching to the treatment, what was the cause? Discovery for the hearing impairment, discovery for the behavior impairment, discovery for the lack of discovery for the less intellectual. So diversity is many things is there, but the child, they have the particular problems. So we go for the particular, that is what the things they want. The clinical feature, children is heterogeneous and complex. It's a very complex. And the features appear in the context, severe clinical feature, children with the differently another, that is the age, cognitive level, comorbidities and sociocultural environment. They are coming from the different environment, different background. They are coming from the different racism. Most important, what I studied, they are coming from the different genealogy. I'm asking about I am interested in their forefathers. And from the contagious changes in diagnostic criteria, clinical descriptions, and disparity of the global prevalence area is not that much available. Some of the Nature's papers, they have suggested that conclusion, we can go ahead. But at present, some of the senior scientists, I have a conversation, they may doing their work still. So the research, how I designed this work, to conduct the cross-sectional study, the research team employed the mixed methodological research design. It is one of the mix. We have a team of the principal investigator and co-principal investigator. And we are following the medical centers those are the publicly open and their parents are the less income. So it means that they are approaching to the government pediatricians. We collect the data from that. Autism scale is given by the WHO, that is Autism Diagnostic Interview Revise, and DSM, that is a disorder spectrum TR. They are all controlled by the WHO. They have given the scale. They have given the scale. So according to that, we fix the child into the category, what the problem they are facing in early stage, basically. So out of the 120 children, diagnosed the 61%. That is we think on that. Out of 120, it's a more than 50%. 50%. And it means that the ratio of the autism disorder in the children is rising. Research team are the qualified, they are educated, they are the some clinical psychologists, they are from the neurologist. In addition, staff consists approaching from the medical team from the equipment to site involve the study. Okay, that is okay, no problem. Phase 1, the selection of the field site. We select the field site from the something remote area of the developed cities. Remote area of the developed cities. Some centers is there. Second phase, setting up the training team. Training team is there. It means that how to find out the exact cause. Some team, it should be the specialized. Because when we deal with the child, the person should be itself a kindness to identify the cause. Third, screening the children risk autism. That is one of the important. The clinicians conducted this screening from the autism checklist of the ASD criteria list. Criteria lists are there. How it has the visions, how his pupil should be a dilate, right side, left side, how they have the fear. How they have the fear, because every disease coming from the fear. So these are the screening of the children at the risk autism. And diagnosis assessment. The childhood autism rating scale, that is known as a CAR. That is known as a CAR. It is a parameter. It is a worldwide access, especially from the reputed institute from the United States. We have taken a reference. So the childhood autism rating scale, CAS, they have mentioned the parameters of the list. 100 points are there. And we can match the child into that 100 points. We make a calculation. And whatever the numbers we get, disease number should be a significant. Disease number should be a significant. According to that, we conclude that he is a set to the category of the behavior, fears, hearing impairment, behavioral impairment, cognitive impairment. So we focus on to the right treatment. Estimating the best diagnosis. Phase 5 was limiting the further diagnosis, evaluating the 36, identify the complex and atypical symptoms. Complex and atypical. It means out of the line from the whatever the parameter they said. So they are the very complex. It is very difficult to find in the references available. at present. So that complex behavior of the child, it is a very important as well as to diagnosis and treatment. Variables, diagnosis using the structure, clinical observation, by using the DSM, IVTR, and standardized diagnosing tool autism, that is a CAR is there. Cerebral palsy diagnosis was based on the clinical examinations. Clinical examination also important, as well as when you find out the autism, the clinical cerebral palsy diagnosis is important to that. So determined by the ear, nose, throat specialist using the standardized auto diametric test. There is some test is there. It should be a very in order. That is a ear, nose, throat specialist. That should be identified the problem with the cerebral palsy. Variable interest, statistically analysis. That is one of the important. Whatever the data we have, we can use the SPSS, that is known as a social platform statistics. So the category of the different problems should be the segregate. They segregate the problems, but this problem are to match with another. That is important, because it's a examination of the whole body, whole brain scan. So how they match? Even though one to another is not match, maybe both are the possibilities. Result is important. Clinical features, we consider the age, sign of the diagnosis, interaction, social interaction disorder, clinical features of the comorbidities. Conclusion is important. The result highlights that 1 out of 3 children evaluated for the specialized treatment is important. Out of 3, 1 should be autism. That is important. Yes, out of 3, 1, why should be? So, all the children involved in the study were school-going age. They are all the school-going age. Why all the students are not they are the fearless. So 1 out of 3 should be a problem. And especially for the epilepsy, hearing impairment, lack of language, movement of the lips should be not in a proper order. Lips should be a proper order. If it is not in the proper order, it is fall into category of the autism. So the things is there. This is the important, and I would like to add, mostly the boys are suffering from the autism. There is a reason. Reason is not exactly we reach to the why, what is the cause, but it should be there. Boys are the more, because it has boys are the abnormal posture of the adipose tissue, stomach tissue is there, it has been observed, but it's okay. That is under finding, we can say that. Acknowledgement, the important slide. I would like to express my gratitude to highly respected and world-renowned scientists, Dr. Ramesh Paranjape, esteemed laboratory scientist and retired and long-time director of National AIDS Research Institute, Pune, the great knowledge source for this work. I seek the continuous support for my research career. If you want, you can ask me the question. I will